About 20 million people in the United States, including more than half of all diabetics, suffer from neuropathy. It can cause weakness, numbness, and pain in hands and feet. Now a new therapy is helping people get back on their feet. For some, it's like electricity or pins and needles. Others feel like their feet are on fire.
The pain shoot right through my legs.
For Eddie Jeffcoat, just walking across the street was almost impossible.
I might not make it back to the other side.
Eddie has neuropathy. Damaged nerves in his feet have left him homebound for the last 3 years.
It came where I couldn't stand, I couldn't walk.
But now he's walking his dog Bear.
I couldn't do this before.
Even enjoying his treadmill time. And he's done it all in just 90 days.
It's incredible. Most patients start to see results literally with the first treatment.
Dr. Mark Ott says the new treatment for feet and hands centers around an electric stimulator called the ReBuilder. It measures how a person's nerves are abnormally firing, then sends an electrical frequency to get the nerve back into a normal firing pattern.
So for each patient, the way that the unit actually fires is different. It builds a pattern that's specific to you.
The therapy includes exercises on a vibrating platform to help restore balance and neurological control.
It's pretty astonishing to watch the results that these patients experience and the lifestyle changes that it makes for them.
While Eddie's still not up to full speed, he's lost 40 pounds and his pain level's been cut in half.
90 days ago, the pain was a 10. I mean, it hurt real bad. I'm at a 5.
This home unit could help reduce the pain even more. In the meantime, Eddie says the ReBuilder has made life a lot more bearable.
Come on, Bear.
Dr. Ott says almost all of his patients see a change with the therapy. He says the degree of improvement depends on the individual. The ReBuilder treatment is available across the country. It is covered by Medicare and most insurance plans.
In health news now, if you suffer from neuropathy, you probably think there's no way to treat the chronic pain. But a new device on the market is giving many sufferers circulation in their hands and their feet again. Jennifer 𝐃𝐈𝐒𝐂𝐋𝐀𝐈𝐌𝐄𝐑𝐒 shows us the ReBuilder.
It's like going to a dentist and get anesthesia and your mouth get numb. That's how my feet feels.
A pained 67-year-old Ruth Abdullah is forced to stomach every day.
I couldn't run. I love jogging, and I had to give that up because sometimes my leg would just give out.
Ruth does everything she can to control her diabetes, but in the last year, she's developed diabetic neuropathy.
It's caused by lack of circulation. So unless you can do something to cause or something to solve the circulation problem, the neuropathy will continue.
And for Ruth, the answer came from Dr. John Krause's newest device, the ReBuilder.
It sends signals up through the limbs, through the lower spine, back down to the other limb.
Essentially pushing the nerve cells back together that the neuropathy moved apart.
It feels, just like a massage.
While there are drugs on the market to treat the symptoms of neuropathy, Dr. Krause says this 3-time-a-week therapy gets more to the root of the problem.
In combination with having feeling back in the lower limbs, they also have the strength to be able to use those limbs.
I didn't thought that there was any treatment for it until I came to Dr. Krause. He said, wow, I can get those feet back to working again for you. I said, you can?
Since Ruth started rebuilding at Tree of Life Chiropractic 3 weeks ago, she's been able to start doing the things her diabetic neuropathy put a halt on.
And I put my feet on the floor, I could feel, could feel again, and I want to be whole. I want to feel whole. I don't want to walk around the rest of my life, and after a little while, I won't have any kind of feeling at all.
In Lexington, Jennifer 𝐃𝐈𝐒𝐂𝐋𝐀𝐈𝐌𝐄𝐑𝐒, News 19 WLTX.
Well, Dr. Krause also says patients should see marked improvement in circulation as little as 3 weeks.